Hi everyone, I'm Dr. Amir Karam, board certified facial plastic surgeon and founder and creator of Karam MD Skin. I specialize in facial rejuvenation, which basically means I help people look as young as they feel. And today, folks, I'm gonna show you an incredible example of a patient who was 49 years old when she started her facial rejuvenation journey with me and underwent basically what I consider the most effective and efficient path to anti-aging. You're gonna see her 2 years later, and you're going to understand both from her perspective as well as from mine, what changes have happened over the years, but also what changes we created as a result of our facial rejuvenation approach. You're gonna see her at 51 now and review the last 2 years of her journey, looking at the stages of her recovery as well as just the overall evolution. But also what you're gonna get out of this is you're gonna understand the rationale between what I consider the simple path to facial rejuvenation, which is focus concurrently on skin and focus concurrently on shape. My approach has always been equal consideration to skin and equal consideration to shape. Skin is managed on your own. Shape is managed in the operating room. And as we review the entire journey, you'll understand how these two things come together, because when you see Brandi at 2 years later, you'll know, wow, she looks a lot younger than 51. And I'm proud to say I had a role in both of those, but I give a lot of the skin aspects to the fact that she has been a huge advocate for her own skin for the last 20, 30 years. All right, folks, so let's break it down. All right, so Brandi is 49 years old in this picture here, and on the front view, you can really tell what's happening. Let's start off with the eyelids. You can see there's this extra skin up on the eyelids. It's kind of drooping over her eyelashes. On the lower lids, there's this puffiness and extra skin that's affecting this area here. You can really appreciate it looking at the other side. You can see the corners of the eyebrow is pointing down, and this is kind of a sign of brow laxity. You can see the mid-face is descending down in this direction, as well as the jowls, and a little bit of pre-jowl depression right here, some volume loss under the eyes, above the eyes, in the temple, and this distance in her upper lip, as you can see, has gotten quite long and made this face look like it's overall drooping downward. So the net effect here is we're gonna basically try to reverse these directions by bringing everything back up, and that's the nature of the vertical restore, including the outer brow, and also remove some extra skin here on the upper and lower eyelids, as well as some fat, and shorten this distance between the upper lip and the nose. All right, so let's look at Brandi's 3/4 view. And this view I like to use a lot because you can really see the contour of the jawline and the neck. And as you can see here, we refer to this as jowls, and it's quite heavy. This section up here is the mid-face, and it's also come down, making this nasolabial fold look heavier, and also causing a little bit of a depression right in the middle of the mid-face. Also in the upper face, you can see the corners of the brow have descended slightly. So what we want to do in a situation like this is basically lift the neck up in this vertical direction, lift the jowls also in a vertical direction, and bring this mid-face back up into position and the lateral brow back up. And in order to do that, we're gonna make an incision along the hairline here, and then down behind the ear here, and then behind the ear. So this is Brandi in her 30s, and you can really tell that structurally certain things are much better placed here. So if you look at the corner of the brow, you can see the attitude of the brow is much more in a position of horizontal as opposed to vertical. These nasolabial fold and mid facial structures are not as deep as they were in the before photo. And of course, the shape of the jawline looks much more all around youthful. She's smiling here, makes it hard, but the distance between the lip and the nose is shorter as well. And when you look at the eyelids, even though she's always had some fullness around her eyes, she definitely has more volume in her lower lids and less skin on her upper lids.
In February of 2022, I did a vertical restore surgery with Dr. Karam. The number one question I get is how have the scars healed? And I think that they've healed up really, really remarkably well. Even with my really short pixie hair, I'm able to hide the incisions underneath the hairline very well. The incision itself is very, very thin, maybe like pencil line thin. They're very, very light white and completely flat to the skin. I'm really, really happy with the way my scars have healed. I get a lot of questions about numbness and how long it lasted. The first couple of months, I would say there was just overall numbness on my face, but I noticed it started to dissipate, and then it started to dissipate in certain areas a little bit quicker than others. Around this area here, I had probably the longest amount of numbness, but it was never anything that was unbearable or something that you couldn't handle. It was just one of those things where I realized that the nerves just kind of needed to reconnect and rejuvenate and kind of come back together, and that I would get feeling back there. And I definitely did. 2 years later, I don't have any numbness whatsoever. And really after even the first year, I realized there was really not any numbness either. It was just really mainly those first few months where I really felt it. Then it kind of just started to dissipate, week after week. I get asked if people treat me different since surgery, and I don't think people treat me differently, but what I have found is that I do get recognized in public quite a bit. No matter where I go, if I'm in a place where there's a lot of people, I'll have people that'll come up to me and say, "Oh, I follow you. I watched your surgery process." And so that's maybe one of the different things that have happened since I had surgery. But as far as the general way of how people treat me, I think people treat me just the same as before. So life's completely different 2 months after surgery compared to 2 years after surgery. It's amazing how many changes can happen in that amount of time. 2 months after surgery, you still have so much swelling going on. You have numbness that's there still. Your face is still really transforming at that point. Whereas 2 years out from surgery, you're through all of that. And so the swelling is gone. There's no numbness. You're just really enjoying the benefits. I actually have told people, I thought I looked really good 2 months after surgery, but I feel like I look better 2 years after surgery because everything is just kind of settled into its natural place now without the swelling. And I'm super excited, super happy with my jawline and the things that were really bothering me before. All of those things just don't bother me anymore. I was at a place in my life where I felt young still, but I really just felt like my face was just so tired and it didn't feel like it matched my personality and the rest of how I was feeling as a person. And after having the surgery, I feel like it just kind of connected those two sides back together again. I feel like I just got a little reboot, and I'm good to go now for as many years as I go. I think one of the most important things is at this stage of the game, after having the surgery, is just making sure that you really take care of your skin after, because while surgery can do a lot and it can do the lifting, it really doesn't touch the integrity of your skin. And so it's really important. I use Dr. Karam's trifecta, and that's my main skincare, and it's amazing. I'm a big fan of retinol. I do microneedling, I do my daily skincare, I go in for monthly facials. But I've had people ask me, you've had a facelift, so why do you feel like you need to do all of these things after? But the bottom line is, a facelift doesn't stop you from aging. If I had a facelift and my skin integrity was bad, it wouldn't look as good. Just keeping that skin, revitalized, using the retinol, kind of overturning the skin cells, it's so important to kind of keep that youthful appearance. And so definitely you want to take care of your skin, do your daily skincare, and be very, very consistent with it, morning and night. Use that retinol, use the trifecta. It's amazing.
All right, folks, I hope you enjoyed that. That was an incredible inside look in a pretty long period of time, 2 years after facial rejuvenation surgery, hearing from Brandi, seeing her evolution, seeing the changes that we're able to create, and also reinforcing the absolute most important thing, which is take care of your skin on your own. And that's frankly why I developed the Karam MD trifecta, to make that step really easy and thoughtless. And Brandi, I'm extremely proud, who's been on the trifecta for quite some time. And also the impact that vertical restore and facial rejuvenation procedures can make in a person's life and changing their sense of self, changing their sense of confidence, and giving them the hope and support that aging going forward from here on out isn't going to be as daunting and as negative as it otherwise would have been. All right, folks, I hope you enjoyed that. If you haven't already, make sure you follow this account. Make sure you like the content if you enjoyed it. If you have any questions, drop them in the comments below. I'll try to answer as many as I can. And as always, please share them with some friends and family. Let's get the word out and show what is possible at the most cutting edge level of facial rejuvenation surgery. All right, folks, until next time, Dr. Amir Karam.